Hi, I'm Huie Lin with the Houston Methodist Adult Congenital Heart Program, and you are here with us on day 4 of Houston Methodist Adult Congenital Heart Awareness Week. And before we get started today on one of my favorite topics, we're going to be talking about food, and we're going to be talking about the right kind of diet with 2 wonderful experts here with us today. But before we get there, let's just talk about a few things to get us started. The first is that you can get continuing education, as with all of our programs this week, by going to this link, https://tinyurl.com day4ce info. And then likewise, physicians, you can also get continuing medical education credit by registering here or clicking on this QR code. You can go ahead and evaluate our activity, and then as always, print or download your certificate in PDF format. If you're interested and you find this rewarding to be part of this activity in terms of patient education, join our Education Advisory Board. We are looking for patients and family members of adult congenital heart disease patients to join our Educational Advisory Board and to not only be here in the studio with us when we do DeBakey CV Live on adult congenital heart topics, but we're also looking for people who can help us to inform what topics we should be talking about and what direction we should go in. So if you'd like to join us, please email one of us there, either myself or Chris Ibarra. And then finally, we were recently awarded a grant from the Patient-Centered Outcomes Research Institute to create a roundtable of stakeholders to help to inform the types of research questions that patients with adult congenital heart disease here in the Texas and surrounding states region are interested in. So if you're interested, join our stakeholder group. You can either go to the QR code or go to the website there, or email us at scachdcollaborative@houstonmethodist.org. And without further ado, I'm very excited to get started with our program today, in which we're going to talk about some pointers on how to really optimize your health through your diet. With us here today in the studio, we have 2 wonderful experts. First of all, on my left is Annie Ulchak, who is a lifetime patient who has the absolute expertise of navigating the very difficult waters of being a complex congenital heart disease. And then to her left is Araz Sarkissian, who is a licensed clinical nutritionist and dietitian who has had 7 years of experience at Houston Methodist Sugar Land. Araz.
Yes, sir. Thank you for having me. So a little bit about myself. I am a registered dietitian. Traditionally, my family and I, we consume a Mediterranean-like diet. And over the years, and this has contributed to our Armenian and Lebanese roots that we have. So just naturally, we kind of adopted this type of diet. And over the years, my dad and his side of the family have kind of been experiencing their share of heart complications. And after growing up, my dad had a heart attack in the 90s, and so after that scare, I noticed my mom was extra cautious and she was extra health conscious when she was cooking. And so what little red meat we were eating got minimized further, and our salt intake was far more scant than before. And so I think that is a culmination of why maybe cardiovascular health and nutrition has an interest for me. And I think that just the concepts, when applied, it can help not only people who have heart conditions, it can help anyone who wants to better their health, who wants to increase their longevity and just improve their lifestyle. And over the past couple of years at Houston Methodist Sugar Land, I've had the opportunity to work with the outpatient cardiac rehab participants and doing nutrition education with them. And that's been rewarding, just seeing them take interest in their health and optimizing, their health and nutrition status, I think is awesome. And so today I have the pleasure, and it's a great pleasure actually, to be sitting next to Annie. And she's kind of overcome so much. She has a lot of knowledge and experience within the CHD realm that she's going to be sharing with us today. So thank you, Annie, for being here with us.
Thank you, Araz, and thank you, Dr. Lin, for having me. I truly appreciate this. It's an honor to be here. For those who don't know, I am Annie Ulchak. I come from Boston, Massachusetts, and I am a 42-year-old nomenclature HLHS patient with a double inlet right atrium and a double outlet right ventricle. I also have pulmonary stenosis, and when I was in my late 20s, it was when I was diagnosed with congestive heart failure and also FALD, Fontan-associated liver disease, and that caused serositis of the peritoneum on top of everything else because, why not add to the mix? So because of this new diagnosis, I worked with my cardiology team, and they gave me a wonderful GI doctor who wanted to figure out how can we stop this process of constantly filling up with fluid. I mean, I was getting a paracentesis every couple of days to the point where after the 40th paracentesis, I just lost count. And the congestive heart failure part was also figuring out, all right, how do I now maximize my diet so that I can enjoy eating, but feel like I'm not living on steamed food and, dry products. And that for me resulted in a sort of like going down a rabbit hole of finding out and figuring out the diet that I had. It becomes now a brand new, and I call it food lifestyle, including with my liquids too. We have to think about all those. And everything I eat day to day, every time I plan something, it's always in the back of my mind. How is it going to help my liver? How is it going to hurt my liver? How is it going to help my heart? How is it going to hurt my heart? And working with my medical team and working on my own parts and working together, I was able to make the congestive heart failure. Now, I was very fortunate with the medications and doing what I did. So everyone's reactions to things are going to be very different, but I was able to make it so that when they look for my CHF, it's so minimal, it's barely there. My fluid, which I haven't had to have a paracentesis in many years, my liver looks very good, it feels very good, and the fluid that surrounds it is extremely minimal. But as you can see, without revamping my food lifestyle and what I put in, it wouldn't have happened, and I'd still be in that point of misery.
So it sounds like we're talking about two very important topics and two very important goals. So on one hand, we're talking about the salt restriction, and the other one we're talking about the caloric and fat restriction.
Correct.
So why don't we tackle first the salt restriction concept? From my standpoint, we often tell our patients, okay, we now have diagnosis of heart failure. We're worried about the salt causing you to retain fluid. And then, of course, in addition to that, if you have a high salt diet and then you also do not control the fluids that you take in, you're going to retain it. It's going to go into tissue spaces, and then worse, it may actually enter into the liver and then ultimately congest also the lungs as well and cause shortness of breath. So then thinking about that, that's the assignment that we give to our patients, and we tell them, okay, you've got 2 grams of sodium and you've got 1.5 liters of fluid restriction a day, which is great for a physician to say, but when I think about that as a person who loves food, that seems completely impossible. And it hasn't been fair because we don't tell patients how to do it.
Yeah.
So tell us how you did it, Annie.
So my doctor gave me that exact same, this is all you can drink and this is all you can eat in terms of sodium. And I cried, I'll be honest. I went home, I was very depressed, and this is what I tell people, own that emotion. Be honest with yourself about it, that it's going to suck for a moment. Your taste buds take 7 to 10 days to change, and that's something that we have to realize, because all of a sudden you are feeling like you're eating a lot of bland food, but I promise you, after you continuously eat it, it becomes normal in your sense of how it's going to taste. So I had to research, as we can see here, these are just a minimum of spices. I had to figure out, how do I make my food that I've enjoyed for a very long time taste at least, if not almost the same, as close as possible? How do I then make it so that I'm not so thirsty because of the salt content that now people have told me you're only allowed this much of fluid intake? Well, how do we do that? And some good things like just sucking on ice cubes, different things to slowly get it down. You measure out what you do, and that's really what becomes difficult, is you have to learn how to do, in a way, measuring everything in the beginning, seeing what exactly is X amount in a plate, what is X amount in your hand. How do you measure that, so that when you're going throughout this permanently, you can now, without needing to measure, well, this food has this food has that, this food has this. I can put it together. I already have my goal for the day. And the more you do that, the more it becomes normal, because it's a new normal for you. It's a new palette for you. But like I said, it's when you don't have someone to show you or tell you or come to your house or talk to you through it, it's daunting, it's scary. But luckily, we now have, a lot of ways on the internet of finding lower sodium. We have a lot more options in our stores. Even before, when I was there, I had to learn how to make things lower sodium. Now I look on the shelves and I'm like, wow, I don't even have to think anymore. I've got everything written out right here, and that's the beauty of going to different things and seeing. So, yeah, that's how you... That's how you manage.
Great story. That's a wonderful story. So as always, I've been a little bit remiss to show you how you can actually enter into the conversation. So if you want to send us your questions or your comments to either Araz or Annie, please go ahead and join us either by web. Go to pollev.com, that's POLLEV.com, and enter in DeBakey, DEBAKEY, and from there you'll actually get the opportunity to go ahead and send in comments or questions. Or you can use your phone and join by text message by texting DEBAKEY to 37607, and from there you can go ahead and text in your message. So fantastic story, Andy. This is a really great way to start. So Araz, talk to us about what you tell our patients, because we've just given them the impossible task, and as Annie told us, it starts with a cry.
For sure it does. And I work inpatient, and so we're only there, it's like 5 minutes versus, lifelong, so to speak. So, I mean, we can talk to the patients for 30 minutes, an hour, but, in their stressed state already, how much of that are they going to retain in a hospital setting? It's really important, we encourage anyways, for patients to see outpatient dietitians, just to have someone to follow along on their journey, help them stay accountable. Should they have any questions, this and that, they can do that. But in general, we do also kind of give our general recommendations. And then we try to also base it off of what the doctor is telling them, what the doctor is recommending. Congestive heart failure, or for whatever it is where sodium has to be restricted or they're fluid overloaded, something like that. Sometimes the doctor will give them X amount of sodium. Sometimes they won't. So that's kind of hard to gauge. What am I supposed to tell the patient? I don't want to overstep and tell them something the doctor hasn't told them yet. But typically in very severe cases, I guess for CHF anyways, we do recommend like keeping your sodium less than 1,500 milligrams a day, or if it's less severe, if it's something just to keep their blood pressure down, keeping it below 2,000 milligrams. So there's different recommendations, but one of the important factors is learning how to read the nutrition label, and that's something else that we tend to try to give a brief overview, if possible, to our patients, is showing them how we can interpret the nutrition label, showing them the serving size, showing them that this is how much you get for the serving size. If you eat more, you're going to have to add or multiply. So doing that, and then also shopping, what to watch out for. As Annie mentioned, now there's a lot of low sodium products, right? So low sodium, no sodium added, just learning the lingo and not getting fooled by the labeling. Because if sodium is not added, that doesn't necessarily mean there's not sodium in it. So that's a big thing that trips people up. So always turn the can or turn the item over where you can see the label and look to see if there's in fact sodium. If there is, then it's a lower sodium product. Or you'll see an original can of whatever it is, beans or corn or something like that. And so right next to it, its neighbor is probably the low sodium product, or it'll say reduced sodium. So you always want to flip both cans and kind of compare. You know, the original can started off as 1,000, and then now the reduced one maybe has 800. Mm-hmm. So it's reduced, but not by that much. So you still want to pay attention. We encourage people, if possible, to stay away from canned products. We understand that it is a convenience thing. So if you must have any type of canned goods, make sure you drain it, make sure you rinse it a couple of times just to get that excess salt out, because it's canned or it's packaged, it's being preserved with salt typically, right? So those are the big things. And then also, anything that's like condiments, anything that's pickled, any type of deli meats, you know, everything has salt, unfortunately. And so it's just about, the key thing is learning how to read the nutrition label and kind of going from there.
Great. So we're getting a video queued up where we can actually go through the specifics of a really wonderful meal being prepared. But before we go there, since we've talked a lot about reading the nutrition label, so Andy, why don't I go ahead and give you this, because I think you guys brought this in, and maybe you can point to us where you go to when you look at the nutrition label, and guys, maybe we can get a little close-up of the nutrition label as we go through that. So walk us through your process, Andy.
So in this one, what I tend to do is I'll look immediately at the sodium. If you look there, it's 20 milligrams. And so you have to say to yourself, okay, well, that's 20 milligrams. And I know, you know, you have that moment of math in the kind of back of your head. With the 20 milligrams, you say, so the serving size is 3/4 of a cup frozen. However, it's a half a cup prepared. So what you do, if you're going to cook the whole thing, because it's a lot easier, and the beauty about this one too is you can cook it right in the package. Some of the others, you have to get a bowl out and all that jazz. And you know, after a long day of work and etc., you're very lucky that this is just, say, caution hot steam. So quickly you do it, and then you measure it. You measure it out, and you add it in, but you want to, when you're first doing this, you want to write it down, that you've put 20 milligrams. You've measured out X amount of cups, so that when you're making up the rest of your meal, you're then also saying, okay, this meal now has, because when you're doing sodium, you have to divide it by how many meals or how many snacks that you want in a day. Otherwise, you're going to willy-nilly, and you're going to either be over or under, and it's depressing. So by doing that here, it allows you to have that control. It allows you to understand, you know, if you're a little bit hungrier and maybe you are allotted a little bit more sodium at the end, and decide, oh, I'm not having any dessert tonight. I want more of this meal because it was really good. Now you can add that in, because you've already done your numbers for the day to say, I've hit, you know, maybe I'm allowed 800 milligrams of sodium. Maybe that's a little low, but for some people, I mean, I was even lower than that in the beginning. It was that bad. And my quest was finding out how to be even less than 100 milligrams of sodium on certain days when I noticed, it was tough. But finding all those products and sitting there and doing the math out, I learned in the morning I can have this with this. And a lot of people have a lot of the same meals all the time throughout the week, or when you're doing planning meals. Yes. And you know, by measuring, I've planned this meal, I know that I'm going to have a cup of this soup, and that's only going to be 50 milligrams of sodium, and including the vegetables too, because those all have natural sodium. Mm-hmm. Those also have, you know, depending on the type of fruit or vegetable you're eating, liquids. Mm-hmm. You have to think about all of that. But yeah, that's what I would do. I'd look at the sodium. If you're looking at carbs as well, some people feel that carbs can help with the reduction of sodium if you're a little bit lower, which, you know, is one of the things I have done as well. And you just measure it out, count it out, and do it. And it becomes a process that you all of a sudden just can do very easily without any more needing the measuring, the this, the that, and you know this meal is going to have X amount. This is what it's going to look like on my plate. Different things like that. So I even took pictures at times. So I knew my measurements, and you know, I put my palm, a little palm, but I would put it next to it, so I kind of got an idea. So then your own hand or certain things becomes something that you can easily use without having to get, you know, all these cups, all these teaspoons, all these things. It's, you know, pinch of this or this or that, and becomes what you are used to.
That's fantastic. So I just want to summarize really quick, because the pearls of wisdom are actually coming fast and furious now, right? So first of all, Araz told us, you have to know what you need to go for as far as your goals for your diet, right? Is it 2,000 milligrams of sodium? Is it 1,500 milligrams of sodium? And then how much fluid can you take? And then from there, Annie told us then you got to measure it, right? So how do you measure it? So Annie's gotten to a point where she can actually use her hand, right, to estimate how much content she actually has there. But then you also have to learn how to read the nutrition label. It doesn't come easily, right? So I would imagine that at some point you probably sat with a dietitian and actually tried to understand what's on the nutrition label before you actually even started doing it on your own.
Shockingly, I was not giving a dietitian at all.
Okay.
I was told, this is what you have to do. Do it.
Oh my gosh! Oh my gosh!
Unfortunately, that's a lot of patience, and
Yes.
that's why it's so difficult. A lot of people don't know what the next step is or who to ask for if they're not giving it to you. I didn't know if they had a specific cardiac dietitian. I mean, it was so new, and everything was such a shock. All I knew was that I now had restrictions. I now had a belly that looked like I was 9 months pregnant, full of fluid, and I couldn't even run when I was training for the marathon. And here I can no longer do any of that. Let alone walk to my toilet without gasping for air and hoping that my next meal might be something that I can enjoy again. I can try and make it. So it was a lot of research, a lot of library, a lot of measuring, and a lot of I'm determined to make this and show and prove, because there were times I would go in with more fluid. Some weeks all of a sudden I'd be in for more paracentesis, and next thing, and they would say, oh, you're not. And I could show them my book of everything I would do, and they'd say, oh my goodness. I'm like, we got to figure it out.
Yeah.
We've got to figure out what's going on. And we worked, like I said, as a group with medications and everything, and changed certain stuff. And some of that experimentation with medications and with all this food and more, it worked. It took a long time. It was not a process that happened overnight, and that's what people have to remember. None of this is going to happen overnight. This could be months, this could be years, but if you work at it, it does come together. It will get easier, and things start tasting really good, I promise.
That's great advice. So I think the other thing that I heard that was really important is that you have basically a notebook, and that you write in there how much you have with every single thing that you put in your mouth, including not just the quantity that you're going to have, your palm size, but then the amount of fluid that's in it, but then also not only what's on the label for the sodium, but then also the amount of sodium that's contained in the natural food products on their own. So I'm guessing you probably had to look that up.
I did. I had to look everything up, including, if I had a nice big juicy apple, and a lot of the food we have today tends to be double the size than what it used to be. So, if you're getting something that's this big versus something that's this big, you're actually going to get a full cup of water, and there's your cup gone. And you're thinking to yourself, oh my gosh, I'm so thirsty. Well, I just had it in my apple. There's my allotted amount that was left. So it is a lot of, and I think that's what patients will say, I can't do this, because it's daunting. But when you're hopefully given a dietitian who can work with you and say, all right, what do you normally eat day to day? How do you normally eat? What is your diet consisting of? Is it like a Mediterranean, or is it more traditional where it's just meat and potatoes? Or is this person a vegetarian? Or, any of those diets out there. How do we change that so that you can still enjoy that food lifestyle or diet, as you may want to call it, but make it healthy so that you it isn't so daunting. It doesn't seem impossible.
So, and then Araz mentioned something that was also very important, which is that regular versus reduced sodium versus low sodium versus no sodium or no salt added are very different things, and don't necessarily have a quantitation associated with it. So you still have to read the label, and you actually have to incorporate that. And then she gives some tricks on how to actually remove any excess salt in there that you're not going to get anyway. So rinse your beans, rinse whatever's in the can before you eat it. So at this point, these two have done a great job with looking at a cooking video, a beautiful cooking video, and let's go ahead and play that so we can actually start going through that.
Hi, my name is Angela Snyder, and I'm a registered dietitian with Houston Methodist.
And I'm Chef Peter Cox, and today I'm going to be doing a seared salmon with a wheatberry and hemp seed pilaf and a kale and almond pesto. All right, so first thing that we're going to want to do is start making the pilaf. What's really important, especially when you're not cooking with a lot of salt, is trying to impart as much flavor as possible. So the first thing you're going to want to do is get your wheat berries and your hemp seed, and you're going to want to toast it in an oven at 325 degrees just until it changes color slightly and it becomes kind of aromatic. It's going to have a nice nutty flavor after that.
The chef here is using wheat berries. Wheat berries are a whole grain. They're actually the whole wheat kernels. These are very high in fiber and magnesium. They're a great substitute for rice or any other refined grain. Hemp seeds will add a great nutty flavor and texture to your dishes. They're high in healthy fats, thiamine, and copper.
All right, so in the video we see that they're using wheat berries, right, as a substitute for rice. But what if you have an intolerance to wheat, or what if wheat berries or rice, what if you don't prefer these items? What else can we use, Annie, to substitute for the side?
So there are some great substitutions, and I know I keep shouting this one out, but there is the rice cauliflower. There's also a mix of rice cauliflower with broccoli too, which is quite yummy. The only difference is you don't want to cook this in with those vegetables. You want to just do this separately and then cook the vegetables, and when it's at the end, just incorporate them, because otherwise you're going to have cauliflower mush. So, but yeah, no, these are really good if you have gluten issues. Quinoa is another good one too. Because quinoa takes a little bit longer time to cook than a wheat berry, I also suggest doing that separately so that it doesn't burn. Because trust me, I've burned too many quinoas and had to throw out too many pans.
I guess the benefits to using broccoli and cauliflower is that they're packed with vitamins, nutrients, all these minerals, mostly vitamin C, calcium. They've got actually this sulfur compound called sulforaphanes, and these actually help slow down or prevent osteoarthritis. They can help lower your blood sugars. They can also help, or probably help, stop formation of cancer cells. So I think that's very beneficial, just to adding these two types of vegetables in as a side. They do serve as antioxidants, they're anti-inflammatory, but I would just caution if anyone is on blood thinners. So whether that's warfarin or whatever else it is, Xarelto, things like that, you might want to watch your leafy greens. Not so much the cauliflower, but probably the broccoli. It can interact with these blood thinners because the blood thinner is thinning the blood, while the broccoli itself, it contains vitamin K, and vitamin K tends to clot the blood. So it's not that you have to eliminate this completely from your regimen. It's the fact that you can have this, especially if it's part of your daily life. You just have to keep the intake consistent. So a little bit every day versus I'm going to have this much today and then 5 days from now I'm going to have it again. That's not going to work out. So I think that's the key thing with certain leafy greens that we'll see later on as we go along, that if you're on a blood thinner, again, and this is mostly focusing on warfarin, we do talk to a lot of our patients about this, which is why I'm emphasizing it. You can have these things. This isn't, I'm not telling you don't eat it. Please don't interpret it that way, but you just have to be consistent with your intake.
Yes. Yeah, I think that's one of the most important messages, because I think a lot of times our patients walk away with hearing that they can't have leafy greens. And that is definitely not what we're trying to tell them. I think just as long as it's approximately the same amount every day, so that way you're not chasing your INR up and down and up and down. So I think that's a great piece of advice. Consistency is really the key. So yeah, so let's hear what else you guys have to say.
Just quickly, as my cardiac team told me, we're not going to base your diet around this medication, or I should say, we're not going to base this medication around your diet. We're going to base your diet around this medication so you can enjoy all this consistently and eat it without saying, well, there goes everything that, you know, I've loved and enjoyed.
Or on the other side of it, it's not a green light for you to stop eating vegetables.
Yes.
Which,
Yes.
which a lot of patients, they're like, okay, great. Like, I'm not going to eat them. I don't eat it anyways. It doesn't matter. If you don't eat it anyways, fine. But if you do have cardiac conditions and things like that, where you do need to include more fiber, you need to include more fruits and vegetables, then it is encouraged for you to consume it for sure.
Yes.
And then one other thing of caution is that broccoli has phosphorus, and so phosphorus will build up and that'll intervene with your renal function. So if you do have any renal conditions, any kidney conditions, you just want to take caution of the fact that broccoli will give you this type of nutrient. And in that case, if you need to talk to your doctor about taking a phosphate binder or whatever's most appropriate for that condition.
Great. Yeah. And I just want to mention, we had gotten a question online, but it got cut off. So if you want to send in your question specifically, we'd love to get that. So should we return to the video?
Yes.
Okay.
You're going to take your avocado oil, just get a little bit into the pot, and then you're going to start sweating off your vegetables. So it's going to be about 2 ounces of onion, and then the same amount of carrot and celery. We're going to throw in a little bit of garlic, just a couple pinches, and we're just going to saute that. And when it turns translucent, we'll add in the wheat berries, and then to your preference, whether you want to use vegetable stock, low sodium vegetable stock, or water. Vegetable stock will impart more flavor, but it does have slightly more sodium, obviously, than water does. Now that it's starting to get translucent, the vegetables are about ready. I'll just go ahead and add in the wheat berries. Toast those a little bit more in the pot. And then we'll go ahead and add in the vegetable stock. You're going to want to go about 1 inch over the wheat berries. And then you'll just turn that down to a low simmer.
All right, so Chef, Chef is giving you an alternative there for the vegetable stock, right? So you have vegetable stock, and then he says that you can also use water as, of course, the low or no sodium option. But Annie, are there any recommendations that you would have or something you typically cook with aside from vegetable stock?
Yes, for me, I feel like sometimes a little bit more flavor is a chicken stock. I mean, vegetable stock can be tasty too, but it can have a sweetness to it, and chicken stock gives you that little bit of extra savory taste. But what I use, I either use a no sodium, and like Araz said, I will go to the grocery store and flip each and every single one of them to see, is it really no or low sodium, so that I'm getting the best one for me and knowing how much I need to do. But another great one is I get a powdered no sodium, and so it's 1 packet to a cup of water. You put it together, and I really can't express more or stress more that it tastes really delicious. And they also make it in a beef form too, which is wonderful for any kind of dishes or recipes that call for beef broth. And
so this is not bouillon, right? The old stuff that I grew up with, right?
It's actually made by that company, but they've realized that a lot of patients out there, heart patients, liver patients, like all sorts of people, do need an alternative. So how do they break into that market? and make it so that I or anyone else who has to get lower can. And I mean, if I could take stock on that, I would.
I'm going to go look for it. This sounds great.
And you'd be amazed. It's usually sold out because people do go to it and realize it has its really good flavor to it, and if you want it just to be a little bit more savory, you can do 2 packets with a cup of water, and you're not adding any extra sodium. Yeah,
that's a great tip.
Those are some of my tips on how I do it, or I'll make it. If I'm fortunate enough, I will collect my chicken bones or my beef bones, depending, and then boil them down, sieve it out, and there you have, right there, without anything added except maybe like a bay leaf and some spices or herbs. I have my own version of no low sodium chicken stock or no sodium beef stock.
Yeah, and I know some people like to, I used to do this. I used to pour it into a muffin pan and actually stick it in the freezer. Then you have individual cup-sized portions of chicken
That's
stock.
a good idea.
That is perfect.
I'm not that organized anymore. I used to be that organized, so great.
Yeah.
All right, so should we go to the next step of the video?
Yes, please.
We'll go ahead and make the pesto for it. So I'm going to take my kale, parsley, some crushed garlic cloves, a pretty healthy amount of rosemary, and then we'll do a little bit of pecorino cheese. And we're going to add in juice from 1 lemon. Turn that on in the blender. And just drizzle in some extra virgin olive oil. You want to turn it off and just scrape the sides every once in a while, just so you get all those chunks nice and smooth.
Chef here is using kale, parsley, and rosemary in this pesto. The kale is very nutrient dense, high in vitamins A, vitamin C, and fiber. The rosemary and parsley are there to add flavor.
All right, so a pesto. What do you guys think about the pesto?
The pesto, I was talking to Annie earlier, and the pesto is a little untraditional. For us anyways. So for the people who prefer a traditional type of pesto, we would probably recommend switching it up, removing the rosemary, which is very pungent, and substituting it with the basil, which is the classic. Also, if you still want more greens in there, if you want the kale, you can just do like a half and half. You can substitute with the spinach as well. Also, what pesto contains and what Chef did not add in this situation was the pine nuts. And so pine nuts are also incorporated in the pesto. And if you don't like pine nuts, you can use different types of nuts. It really doesn't matter. This is going to be for you, and you're going to eat it ultimately. So whatever you enjoy, that's okay. A substitute for pine nuts would be walnuts, just because they are rich in omega-3s. So that's a great anti-inflammatory type of nutrient right there. And also, we're going to still incorporate the garlic. We're going to incorporate the lemon just for that flavor. But is there anything else you would add or substitute aside from, let's say, the nuts?
So, as you said, we talked about it. When people are given a new way of eating, you want their food to taste very similar to what they've enjoyed. That, to me, I would be willing to try it, but I don't think I would be happy with it, because when you're telling me I'm going to get a pesto, I want it to be as close to a pesto as possible. So just like Araz said, I mean, you've got your kale, wonderful, but there's nothing wrong with doing half and half, like Araz said, with kale and spinach. You're still getting the great nutrients of both leafy greens, and I think that's what he was going for. We have to remember, though, with pepperoni cheese, you need to measure that. The cheeses tend to have high sodium contents. I've never seen any low sodium, no sodium cheeses, so we must measure the pepperoni. Definitely adding the oil. If you don't want to do avocado oil, there's also the sunflower oil, olive oil. As for the nuts, if you choose not to add any nuts because might be allergic to it, or someone in your household has an allergy, that's okay. You won't miss out on that. But I will say you'll miss out on it if you have rosemary and not basil. And if you add, and you can add the lemon, and trust me, you might want to add more garlic. It has such a savory flavor to it, and it will enjoy. But that's the beauty of all of this, is experimenting. Someone gives you this option, and you want to go a little bit more similar to yours, so how do you incorporate those two? Play around with it. There's going to be some meals that you're going to say, oh my goodness, this is delicious. And then there are going to be some where you just saw and go, why? So, yeah.
So yeah, you're not limited to the items that we give you on a recipe or that you see on a recipe. You can definitely substitute as much as you like. And just touching back on the pine nuts in general, if you have a nut allergy, then you want to do away with the nuts. And in place of it, you can add hemp seeds. You can add any other types of seeds, sunflower seeds, pumpkin seeds.
Just make sure those pumpkin seeds are shelled, because those shells on those pumpkin seeds are salty.
Unsalted is key.
Yes.
If possible, yes, definitely.
Great. And then we have a couple questions here. So the first question is, should I limit red and processed meats as part of a cardiac diet?
We encourage it, and I'm sure the doctors encourage it too. I know that there are a lot of cardiologists that tell their patients, stay away from red meat if possible. I mean, it does increase your risk of all the cardiovascular diseases and certain cancers as well. So that is something you might want to limit. In general, as far as eating animal products, whether it's dairy or meats, you just want to choose the leaner types of meats. You can choose the leaner type of red meat, for example, ground beef. Ground beef on the market, there's 20% to 80%. Then you have the 90-10, the 97-3. So any of those options would be okay. Those are leaner the higher you go. So preferably choosing one of the higher ones is going to get you a leaner product. Of course, selecting poultry, chicken, turkey, those are leaner, without the skin, because the skin contains the fat. Although it's delicious and it has all the flavors, whenever you are conscious about certain things, you want to do away with it. And so again, with the dairy products, so optimal fat content, it's really going to depend on the individual. Definitely items that are made with whole milk, right? Whole milk is full fat. And then the percentages mean that it has less fat content. So from whole milk, typically we jump down to 2%. And then 2% is about where most of us will hang out. But if you're already doing that and you don't see any improvement in your cholesterol labs, then what you can do is you're going to go ahead and reduce it further. From 2%, let's go to 1%. Right? Or 1%, let's go to skim milk. So it's really going to depend on the individual. Animal products in general, they contain saturated fats. And saturated fats are the fats that are dangerous for us, only because these are the ones that are more likely to increase your cholesterol values, your LDL, triglycerides, things like that.
Great answer. So, and then I think I was having a conversation also with another dietitian today where we were talking about how some of the meat substitution products actually turns out have a lot of processed materials in them, so that you may actually be better off just having a lean beef product as opposed to having the beef substitution product, because there's preservatives and all kinds of other things that keep its shelf life.
I have to agree with you on that, and that's what's difficult as a patient, is you see all these products that come out that tout healthy, this and that, but if you actually read the back of it and you can't pronounce half of the ingredients, it's not healthy. It's usually added with extra salt or sugars, because how else are they going to make it taste something similar to what you've eaten? Now, I am a meat girl. I need protein. I've tried doing the other food lifestyles that had reduced protein, and for myself, it really affected me physically and mentally when I did not have enough meat in me. And I tried, higher protein ways, but with some of my digestive issues, the extra beans, the extra things became worse. So when I'm picking out a meat, I'm very fortunate in Massachusetts, we have a lot of farm shares. So I'm getting it straight from the farm, knowing that I've picked one that does not do those extra byproducts inside that animal. And, you know, it's going to be the leanest it can be. It's going to be the healthiest it can be. So when you're searching for something in the store, you know, we have to remember some of our populations may not be able to, that lean meat might be a luxury. So you have to kind of consider your price range too on sales, looking up at sales, seeing what's this. Chicken and turkey tend to be a little bit less, so price-wise as well. So those are great substitutions to use. But you know, it's just about reading, knowing, and enjoying, and seeing, like Araz said, working with your doctor to make sure what you're putting into you is going to be the healthiest, and what works with you too. You're going to know by your own system. Do I feel better? Do I have more energy? Is my fluid less? And if you're realizing that small changes you're making are causing all this positive outcome, then you want to kind of keep continuing it.
Great answer. So let's go ahead and get our final part of the video up, and then I want to go and walk through a nutrition label.
You want to get your salmon ready to sear off. So you want to pat it dry, just make sure that it really doesn't have any moisture left on the outside of it.
Salmon is a great choice of protein. It's high in heart-healthy omega-3 fatty acids and is very cardioprotective.
We're going to turn our pan on. You want to get it nice and really, really hot. And we're going to use avocado oil because it has a much higher smoke point than extra virgin olive oil. Because when extra virgin olive oil smokes, it turns carcinogenic. You're going to want to wait to add the salmon into the pan until the oil is really shimmering and is very, very thin. And we'll do the salmon skin side down. And we're going to sear it really hard. And if you want, actually baste the top of the salmon with a spoon. It'll help kind of seal the other side of the salmon. So it's really important to wait to try and flip this salmon until the skin just releases from the pan. That's how you know the proteins are fully cooked and ready to go. So I'll get a quick sear on this other side. You can kind of go, obviously, however you like to eat it, but I prefer it medium or medium rare. So seal it on that side and then flip it back just to finish on the skin side. So it gets really nice and crispy. And over here, I have the finished pilaf. Just get that warm. Then to plate, we'll put a little bit of this pesto that's finished on the bottom. We'll put the pilaf right on top of that. We'll just sprinkle some of the toasted hemp seed over the top of that. It just adds some nice texture to it. Pat dry the salmon and kind of get all of that extra oil off of it. Just finish it with a little bit more pesto on top, and then I'm just going to finish it with a little bit of celery leaf with some lemon zest. Citrus is another good thing when you're not using a lot of sodium, just to kind of impart more flavor.
dinner just in time for dinner time. So
Making
guys,
me
what do you guys
hungry.
think?
I mean, the food looks good. I would just, for time's sake, give a little tip about how to avoid adding so much oil. Would be to use these sprays. So oil, olive oil or avocado oil or whatever oil you can actually use to spray it. That way you can conserve the quantity that's going on the item, and it's a little more cost effective. You know, you can stretch out your dollar a little better, and actually, preferentially, Annie and I think we would rather bake the salmon. You want to kind of explain?
Yeah, so I think that's a wonderful idea if you're able to do it on the stovetop and kind of flip it around. And like we said, we can also use these sprays. But I know for myself, I'm not a trained chef. I'm not fancy. I splatter and burn things, including myself. So what we had spoken about was one of the great ways, and it can help you while you're cooking all and chopping up everything else, is putting it in the oven. Just a little bit of foil. You can add on lemons. So the lemon zest is a great idea, but to really infuse that flavor, you can add like oregano and some lemon slices right on top. A little bit of sprayed oil on the bottom so you're not burning that delicious salmon skin, and a little bit on it itself, and you can put it in. You can also, if you have an air fryer, do it very simply and healthy way as well. Once again, making sure you put on the herbs that you enjoy and that lemon, or some people even like oranges or limes with it. It's quite tasty. Gives you that different taste to it. And then you just cook that at the degrees and at the time, and while you're doing that, you can chop everything else up, get everything together. It's done. You've plated it, and you don't have to worry about having a burnt bottom. You don't have to worry about, you know, burning yourself with all that extra oil and needing to do all that extra patting, because you've done that reduction already, and now you've got the savory. And it doesn't have to be a small slice. You can have a nice big slice where you measure it out and cut it up, and now you've got several meals in a day that you can enjoy right there.
Yep. Agreed. You're a pro at all of this. You're like a star pupil, and it makes me happy.
It took, like I say all the time, it took a very long time. This was not something that was quick and easy. It took a lot of researching and reading and knowing and, you know, measuring to get to this spot. And because I'm at this very healthy spot where, you know, for instance, yesterday I ran over 3 miles with my Walk Run app. You know, I had a very healthy breakfast, but I look at that as this is where I'm at and this is where I want to remain. And it's a remembrance of why I need to continue doing this, you know, on an often basis and as much as possible. So I don't want to get back to where I had to be in a hospital, had to go through a paracentesis over and over with the pain, with all of that. I want to be where I am now, and hopefully for as long as I can contain and sustain this, continue.
Yeah. Well, so I think one of the key pieces of information, key skills that we want to get everybody with before we finish off tonight is to walk through a nutrition label, because we've talked about this so many times. So, Araz, we've got a nutrition label right there for, I believe they're hemp hearts. Can you walk us through that and tell us what the key elements are that when we look through it? Because it's a bewildering amount of information there.
It really is. And if you have heart conditions on top of diabetes and X, Y, and Z, then you really have to pay attention to everything on the label. So first and foremost, you know, you want to look at the serving size up at the top. And measuring things is going to be something you're going to want to get used to. Annie is used to it now. It's second nature to her, which is awesome. So you're going to look at the serving size, and for this, 1 serving is 3 tablespoons. Okay, so 3 tablespoons, once you measure it out, is giving you all the information down here. Now, if you want to use 6 tables, you know, if you want to double it, then you're going to double all the information over here. If you're going to, you know, not use as much, you're going to use half of it, then you're going to want to divide everything by 2. So it's just a little bit of basic math, but with practice, you know, it becomes second nature and it becomes basic. I say that, but it's really not when it's something new to you. So looking at total fat, we've got 15 grams right here. Fat is in bold, it's an umbrella. And then underneath it, you have the different types of fats. And a lot of you may have seen these names before, maybe not. The 4 main ones are saturated, trans, polyunsaturated, and monounsaturated. And so the poly and monounsaturated fats, those are the good fats. We'll just, put it in that umbrella term as good fats. Mostly these fats are coming from plant-based products. This is a plant-based product. These unsaturated fats, they have omega-3s. That's where it comes from. This will elevate your HDL, your high density lipoprotein, which is the good cholesterol. It's going to elevate that, and hopefully the more of these things that you eat, it'll help lower your LDL and your general cholesterol. And then of course we have saturated fat, with which most of us are probably familiar with. This is mostly going to come from your animal products. Saturated fat is what increases your cholesterol levels. So saturated fat, what you want to do is you want to try to look at the label and select an item that has less. So let's say there's 2 different brands. Well, you're going to choose the one that has the lesser amount of saturated fat. And there's, people will ask, how much saturated fat should I be eating on a daily basis? This will matter. This is based on your daily caloric intake. So the food label is based on a 2,000 calorie diet. And this is not encouraging you to eat 2,000 calories because some of us don't need to be doing so. But just based on this, for example, you want to be consuming 7% of your total calories as saturated fats and no more. So based on whatever calories you're allotted per day, let's say you're eating 1,800 calories per day, 1,500, you're gonna do the 7% of that. You'll get your grams, and then you'll get your, you get your calories. There might be some calculators online you can find. And that's how much you're going to consume. Based off of a 2,000 calorie diet, it's probably gonna be around 16 grams maximum. Trans fat is something really important. This is a caution. You want to make sure you avoid anything that actually has a number next to trans fat. Trans fat is considered a bad fat just because of its chemical structure. Our body has a difficult time to get rid of it. And so these days, luckily, most products, it should say 0 next to trans fat. However, I would go down to the ingredients and I will double check to see if anything says partially hydrogenated oil in it or shortening. So those 2 things, those would be keywords to tell you that it probably has some sort of trans fat. Any of the baked goods, like from a pastry shop, things like that, bake shop, those might use trans fats, like if they're incorporating lard into their recipes, things like that. And so further down, cholesterol, cholesterol and fat, you're gonna kind of want to minimize both of those things. Sodium, of course, we've touched on. You want to make sure that it's as low option as possible. And then also total carbohydrates, I'm just going to touch on when something is low in sodium, or I'm sorry, low in fat. So there's cheeses out there, American cheese, and it says fat-free. Well, if the fat's removed, then they're replacing something to maintain the integrity of the item. And usually what they're gonna do is they're gonna add more carbs. They're gonna add more sugar to it. So this is something you want to be cautious about. And then finally, underneath the carbs is the fiber. Fiber is very important. We should probably be eating a little more. It's anti-inflammatory. It helps lower cholesterol. And so that maintains our gut health. If you're suffering from constipation, it's a taboo subject, but it'll kind of help move your bowels a little bit. So increasing your fiber intake is what we all need to do. So this kind of in a nutshell, and protein, looking down here, protein, self-explanatory. In a sense, this is going to tell you how much protein you're going to get out of each serving.
Wonderful. Mm-hmm. That's so helpful. That's just key information there for all of our patients and all of us, really. So we're running a little bit over time, but I want to make sure we've got some really fantastic things here on the counter to help us to have a flavorful meal. Talk us through what we've got here, guys.
So we have just some examples of leafy greens that you can put in your salads, incorporate in your soups. I know there are a lot of soups that don't actually ask for anything or ask for too many vegetables. I personally, to make it even healthier, will add in a handful at the end of a lot of these different things. Swiss chard is another great one too, because I'm always trying to find a way to impact my nutrition and make it extra, the item to be an extra, what am I trying to say? Just make it better.
Yeah. And you put it at the end so it doesn't overcook.
Yes, that's the other thing. Once again, just like this, it can become mushy. We have our oils here that reduce the amount that get put in. And when people have high sodium flavors, they tend to get used to a certain type of what's going to be on their palate. And for myself, which I encourage you to experiment, having these peppers, I do caution, don't touch habanero peppers by your bare hands. Just touch the stem or put on like a plastic glove. They will burn you. It's the beauty of them. You've got jalapenos, different types. There's also red chili flakes we have here. You can use those dried as well as fresh. Now, one of the things I have to caution about herbs is checking the back of them to make sure there's no extra added sodium to them, because they can do that, especially when you have combination herbs like lemons and peppers, or some of the fancier ones, they'll have added sodium. So for myself, I tend to enjoy using more freshly based ones where I cook in with it or I add it afterwards. And then we have beautiful broccoli and other vegetables that, once again, I mean, I just constantly incorporate and add things. If you're not into cauliflower rice for some kind of meal, you know, there's all these spiralized things, or my favorite is spaghetti squash. Yes. I really didn't think I was going to like it until I tried it, and let me tell you, you can experiment to the extreme. You can add on any kind of oil and herb and really just make it into something so delicious, and it's a little goes a long way. It really does fill you, and that's the key about all of these different things and items, is how do I make it taste so that I enjoy eating it, as well as maybe my partner and my family or my friends. But then how do I make it so that not only do I enjoy eating it, it's filling me up. Yes. So that I'm not sitting there saying 5 minutes later, well, when's my next meal? You know, what am I going to do now? Because I just made up my plate or my bowl, and now what am I going to do? How do I not use my sodium continuously? So those are all the key items that we have to remember in terms of like trying something new, experimenting, and that's the beauty. You can experiment to galore. You can add, you can take, but making sure that, as Araz said, you're watching for things that are already pre-made, so that you're not slipping in the sodium and you're not saying to your doctor or to yourself, you know, I woke up this morning extremely bloated. Why? I did everything. And then you look and you say, oh my gosh, this is 80 milligrams and I didn't even realize it. Or you look it up online and say, this is the key. This is the reason. So. Yeah.
Great tips. Well, I have so many questions that we didn't even get to. I think the best thing that I can say is that we're out of time, but we can always continue the conversation online. So we are all available on social media, and I would love to be able to continue the conversation with you guys. And of course, we'll also have the symposium this weekend where we can talk more about some of these topics as well as other ones. Thank you so much, Araz. Thank you so much, Annie, for being here today. And I think we're definitely going to have to do this again in the future.
Yes.
Thanks for joining us, and we can't wait to see you next time. Join us tomorrow night when we have a Spanish DeBakey CV live on adult congenital heart disease with Dr. Torre and Dr. Duarte. Thanks for joining us, and we'll see you guys next time.